Hello everyone, welcome to my Insure Bites. There are many insurance policies around us, many companies do, but the decision of whether a policy suits us or not depends on our life situation, our responsibilities, and our future plans. In this video, I'll talk about one health insurance policy. I'm not saying this is the best policy. Whether it suits your life, it matches your needs, it fits your level of responsibility, you have to decide. So, this story starts in 2020. Ramesh is a software engineer. He works in Hyderabad. He thinks after marriage, responsibilities will increase. Should I start planning now? He starts thinking about insurance. Should I take it now or should I think about it later? At the same time, he keeps saying pandemic news, hospital bills, ICU stories everywhere. Meanwhile, in 2020 November, Ramesh gets married. Now, responsibility is not just about Ramesh, wife, parents, and future children. Everything comes together. The calendar changes. January 2021 begins. One morning while having tea, Ramesh scrolls through the news. ICU bills, hospital queues, medical expenses. So a thought strikes him. If we take decision during emergency, we decide emotionally. That's when mistakes happen. So Ramesh decides, let's take insurance. He starts checking policy, one for himself, one for his wife, and one for his parents. He compares premium, waiting period, and coverage. Then he gets one clear thought. There should be one single policy that covers the whole family. That's how Ramesh chooses Star Health Assure insurance policy. This policy covers Ramesh, wife, and his parents. Ages at policy entry: Ramesh 30 years, wife 28, father 60, and mother 56 years. Why is this age important? If entry age is below 61, future co-pay risk reduces. Another thought comes to Ramesh. Hospital expenses are not just about admission. Before admission, there are tests, scans, and consultations. After discharge, there are medicines, follow-ups, and investigation. Then he checks the policy features. Pre-hospitalization expenses up to 60 days, post-hospitalization expenses up to 180 days are covered. One more important decision. Father already has diabetes and BP. Mother has thyroid. Many people ignore this, saying these are common. But Ramesh does not. He declares all diseases honestly because the biggest insurance mistake is having a disease and not declaring it. Ramesh knows it. If I don't disclose at entry, I will face problems at claim time. This one decision can save lakhs in the future. 2021 goes smoothly. No hospitalization. But this year is very important because waiting period starts, maternity clock starts, PED clock starts. In insurance, silent years are golden years. In 2022, Ramesh does not rush to a hospital. Instead, he takes a simple decision. We bought insurance for emergencies. Now, while we are healthy, let's do a complete health checkup. After marriage, lifestyle changes, food habit changes, stress level changes. So, in 2021, Ramesh and Lakshmi decides to go for a preventive health checkup. So, what type of checkups are covered? Usually, blood test, sugar, cholesterol, thyroid, BP, ECG, general physician consultation. So, these are preventive tests, no hospital admission needed. So, what is the claim process? Very simple. Book the service in Star Health app. They visit home, collect samples, reports are updated in the app. There is an important note in the policy. Payment of a health checkup claim does not mean future hospitalization claims are guaranteed. So, for example, if sugar is high in your checkup and you don't disclose it in the policy, the company can still reject a future claim if non-disclosure is proven. Later in July 2022, Lakshmi's pregnancy is confirmed. Ramesh feels happy. Then the next thought. Does the policy covers maternity? He checks the rules. 24 months waiting period, husband and wife both must be covered. So your policy started in Jan 2021. Doctor says delivery will be in March 2023. So 24 months completed. Ramesh feels relieved. Okay, timing is correct. In March 2023, Lakshmi undergoes a C-section delivery in a private hospital. Here comes the important question. How much does the policy cover? So in this policy, the maternity benefit is maximum 10% of sum insured. For suppose, Ramesh has 20 lakhs sum insured, so maternity coverage is 2 lakhs. Another important point, in the maternity benefit, pre and post maternity expenses are not covered. So that includes scans before delivery, consultation, medicines, and follow-up visits. Ramesh already knew this, so no shock. For a maternity claim to be approved, these policy conditions must be met. Both husband and wife must be covered under the policy. The policy must be active continuously for 24 months. The delivery must happen during the policy period. Since all these conditions were met, the maternity claim was admissible. After delivery, the baby develops jaundice. Baby stays in NICU for 3 days. Common doubts. Is the newborn baby covered? Are NICU charges covered? Rule is very clear here. If maternity claim is admissible, newborn baby is covered from day 1. NICU test, medicines, all these are covered like normal hospitalization. Since the baby developed jaundice, the NICU expenses were covered under this policy. Now, one important practical point. A newborn baby is not a permanent policy member. The policyholder must inform the insurance company within 45 days from the date of birth. This can be done through online portal, agent or customer care, and baby must be formally added to the policy. For these, proportionate premium must be paid. Only then the baby becomes an independent policy member. If intimation is not given within 45 days, future claims related issues may arise. These are the common mistakes people make in this situation, assuming the entire maternity bill will be covered. As per policy, with 20 lakhs sum insured, maternity cover limit is 2 lakhs. If the bill is 2.2 lakhs, the extra 20,000 must be paid by Ramesh. Assuming pre and post delivery expenses are also covered, not adding the newborn baby to the policy within the given time. Keep these points in mind. Ramesh already knew this and has clarity, so he managed without family stress. In 2023, another incident happened. Ramesh's mother developed breathing issue. She already had thyroid, which is PED, and it was properly declared in policy. But this time, what was the reason? COVID-related oxygen deficiency. They tried hospital, but beds were not available. Doctor advised hospital admission is not possible. Continue treatment at home. Now the main question. How much does the policy cover for home care treatment? As per this policy, home care is covered up to 10% of sum insured with a maximum cap of 5 lakhs per policy year. For example, sum insured is 20 lakhs, 10% of that. So that is 2 lakhs is covered under this policy. To get a home care coverage, the policy requires a strict process. Here, doctor's advisory is mandatory. The doctor must clearly mention hospitalization is normally required, but home care is advised. Continuous medical monitoring is required. Daily treatment charts must be maintained, and if the home care provider is in the company's network, cashless may be possible. If not, only reimbursement is allowed. Cashless will not be applied. And here, many people ask this doubt. Mother already had thyroid, and which is PED. PED waiting period was 3 years, but only 2 years were completed. So why the claim is approved? The answer is simple. Thyroid is a pre-existing disease. Breathing issue was due to COVID complication, which was not caused by thyroid. So as per new policy rules, this was created as new illness and the home care coverage was applicable. In this case, the home care provider was not in the network, so cashless was not possible. What Ramesh did, he collected all the bills and he submitted a reimbursement claim. After verification, the expenses were reimbursed. What are the common mistakes people make here? Taking oral doctor's advice, not maintaining daily records, and incomplete documents from the non-network providers. If these mistakes happen, claim may get rejected. In May 2024, early morning, Ramesh's father, Srinivas, suddenly developed severe chest pain. He was immediately rushed to a nearby network hospital. In an emergency, what is the first important step? Choosing a network hospital, because cashless treatment is possible. After reaching the hospital, the doctor confirms there is a heart blockage. Immediate angioplasty is required. A common doubt comes to everyone's mind. Already has diabetes and baby. Will the claim be rejected? Here the timeline is very important. Policy started January 2021. PED waiting period 3 years. Waiting completed in January 2024. So hospitalization happened in May 2024. The pre-existing disease waiting period was completed. Next common doubt. Father has crossed 61 years now. Will copay apply? The rule is very clear. Copay depends on entry age, not claim age. Father's age at policy entry was 61 years. So, no copay applicable, no 10% payment from own pocket. If the policy had been taken when father was 61 years or above, then 10% copay would have been applied. Many people miss this point. If you take the policy late, this advantage is lost. Now, let's see what the hospital bill usually includes. In an angioplasty, these are all the charges that are covered as inpatient hospitalization under this policy. But there is one important point. Stent cost is paid only as per government cap. No matter how much the hospital charges, the insurance company pays approves only up to NPP or DPCO limit. Any extra amount has to be paid by the patient. Since it was network hospital, a cashless request was raised. The process works like this. Hospital submits cashless request to TPA, insurance medical team verifies the details, once approved treatment proceeds. In emergency cases, initial approval can sometimes take late, but since angioplasty was an emergency, cashless approval was given. One important thing, cashless does not mean 100% of the bill is covered. Sometimes non-admissible items like extra consumables or must be paid by the patient. After the treatment, some expenses were not included in cashless, like medicines brought outside, discharge medicines. Ramesh carefully collected all the bills. So required documents included discharge summary, final hospital bill, prescriptions, payment. After verification, the reimbursement amount was credited successfully. By now, you might feel you have a good idea about this policy, but when a real emergency happens, many practical doubts comes to mind. Let's look at them one by one. By the end of the 2024, Lakshmi develops gallbladder stones. Ramesh gets worried. A big claim already happened to my father. Is there still coverage left? This is where the policy feature helps. The policy has an automatic restoration benefit. Once the father's treatment claim was settled, the original sum insured was automatically restored. So no problem. So Lakshmi surgery expenses were covered as per policy. What if the father gets a heart attack again in the same year? Yes, restoration still applies, but only if it is a separate hospitalization. Now the important clarity. What does the separate hospitalization mean? It does not mean same admission, same discharge, or continuation of the same treatment. For example, in February, the father had a heart attack, underwent angioplasty, and was discharged. If complication happened shortly after and treatment continues as part of the same episode, it is considered as same illness episode. Restoration will not apply in this case. In another case, if after full discharge there is a gap of few months and the father again gets a fresh heart attack or a heart stroke and is admitted again, this is a new hospitalization. This is a fresh event, even if same person, same year, same disease. If it is a fresh admission, the restoration benefit will apply. Now let's talk about the most common and costly mistake, room rent limit. In Ramesh case, he took a 20 lakh sum insured. So as per policy rules, any room is allowed except suite or above category. So there was no major issue. But let's take another example. Suppose the sum insured is 5 lakhs. As per policy, room rent limit 1% of sum insured per day. That means 5,000 per day maximum. At the time of admission, families think emotionally. Let's take a better room. Comfort is important. Now look at this situation. Allowed room rent 5,000, room taken 10,000. The limit is crossed. Many people think I'll just pay the extra 5,000. But the reality is different. When room rent limit is exceeded, a proportionate deduction applies here. For suppose allowed room rent is 5,000 and taken 10,000. What is the ratio here? 50%. That means doctor fees, OT charges, nursing charges, all these charges will be paid by the insurance only 50%. The remaining 50% comes from your pocket. For example, total hospital bill 4 lakhs. Your expectation only 5,000 extra room charge. Actual reality is nearly 2 lakhs from your pocket. This is a very big shock for many people at claim time. So one golden rule at admission. Always choose a room within the policy's allowed limit. If it is 5 lakhs, sum insured, room below 5,000. 10 lakhs to 25 lakhs sum insured, any room except suite. This one discipline can save you lakhs. And strong line to remember here. When room rent is exceeded, it's not just about the room bill that cuts. The entire hospital bill get reduced. Third doubt. It is about consumables. This policy covers only 68 specific consumable items as clearly listed in policy document. Non-medical consumables like diapers and food are not covered. So some out of expenses is always possible. One more common misunderstanding. What is OPD? Doctor consultations at clinics, tests and scans without hospital admission, regular medicines. Does this health assure policy cover OPD? No. That means clinic visits, OPD, tests without admission, regular medicines are not covered. This policy is mainly designed for emergencies, major treatment and large hospital bills. If OPD coverage is required, you need a separate OPD add-on or different type of health plan. So simply put, this policy is about hospitalization, not OPD. What if Ramesh had taken the policy late? No maternity benefit, PED claims could have been rejected. Heavy bills bill would come from his own pocket. What if existing diseases were not declared? Claim would be rejected. What if room rent rules were ignored? Loss of lakhs during claim settlement. In insurance, the real problem is not the policy, it's expectations. You may wonder, with all the incidents that happened to Ramesh, happened to you as well? Maybe not. Ramesh was not lucky, he was prepared. He was able to handle critical situations one after another because he clearly understood the policy. He took the policy early, he understood the rules. Our goal is not that you face the same situations as Ramesh. Our goal is that even if one situation comes in your life, you should have the confidence to manage it smoothly. Insurance does not mean making the hospital bill zero. It means having financial control. Whether this policy suits your life or not, it's completely your decision. If you want more details about this policy or if you want to plan your insurance the way Ramesh did, please contact me. My phone number and email ID are mentioned in the description. If you have any doubts, leave them in the comments. Thank you. Like, share and subscribe My Insure Bytes.